One of our main priorities when it comes to delivering a quality service is having quality staff, and to ensure that we have quality staff is to ensure our staff are culturally competent. When we're looking for a provider for that short-term support, we want to make sure that they are coming in culturally competent. They're not just coming in for the experience. We want people to embrace culture.
Health professionals from RAHC are there to add value to remote clinic services that already exist. Our new refresh model is focused on place-based solutions. It's about connecting with our people and communities and really having a willingness and a genuine commitment to improving outcomes for people and communities. It's about willingness to know about culture and willingness to really work towards narrowing that disparity.
Me Watch would like the health professionals that they come, their understanding of the challenges, understanding of the culture, have a willingness to learn and be part of a team.
I think the other advice that I would give anyone looking at coming and working remote would be just to do your homework as well, and don't be afraid to ask questions. I think we're really fortunate that RAHC and MUACH have this relationship. We're able to work together to make sure that staff that are coming out into community are culturally competent, but also have the right supports in place to support them throughout that process as well.
We support HPs in a number of ways. We do a rigorous credentialing program. Following that is an orientation, both clinical and cultural. The cultural orientation provides a bit of education about working culturally responsibly. It looks specifically at the social determinants of health and covers all aspects of how that interrelates to primary health care.
We're not teaching you how to be a new set of skills, we're teaching you how to take your skills that you've got and transition them into the remote setting and making them culturally appropriate.
We want all of our HPs to feel safe and secure and skilled, but also prepared. It's about them being prepared for a remote area work, knowing what's expected of them, what are cultural perspectives, which can be portrayed across all Indigenous clinics, however, needs adapting to each community.
The remote settings are very, very different, particularly the remote Indigenous setting. It's different again, and unless you're prepared, you're not being set up for success.
Well, the support from RAHC to health professionals, first we pride ourselves in 24/7 support, which means 24/7. If you're not on your placement as a nurse or doctor, that's any health professional with RAHC, you can just call an emergency phone and you can talk to people on call. You always have somebody on call, like a travel team, logistics team, a clinical team on call. Depends on what your inquiry would be, then we'll be direct you to the right person to talk to.
Another key factor is the Remote Educator program, and it is about bringing new to remotes on board. During a placement, a remote educator who will assist a new to remote health professional and work side by side with them.
When RAHC are able to send out an educator with the nurses, it's really important for nurses being able to hit the ground running, especially if the clinic is already short-staffed. It's hard for them to be able to be orientated into the clinic, so it's really important.
It's a very big factor in the success of staff that are coming out, that they get that educational component not only prior to coming out, but the wraparound support that RAHC offer while they're transitioning and on the ground in our remote communities.
It's about ensuring their preparedness as much as they can, and that they're comfortable and that they feel safe, because when we do that, they're more likely to return.